So, as regards cataract and vitreoretina, the first question or the first point that I would like to discuss with you is what is most important? What are the drivers bringing your decision to own, to buy new equipment? Is it innovation, reliability? What is the role, for instance, of the service and the support? What and most important for BVI, what you think it should be the role as regards the provider as a trainer, as teacher, as educator for their equipment? Do you want to start, Claudio?
Okay. According to me, it is important that the company is every day present. If I have a problem, I have to be able to call them, and they have to support me immediately. So I am particularly lucky because I work and live in Rome, and the company is here in Rome. So have no problems with them. But this is one of the main reasons for I use that device. Also, after that, the device is absolutely high performing. Their new instruments are able to help me to manage every type of cataract. And so in the last few months, they changed the software of my Revo Smart, and it had an increasement in the efficiency, and so I normally use two different instruments. When I do the surgery, I have two surgery rooms at the same time. The patient undergoes the flax, and after that I use either the Centurion or the and now with the new software there is no more difference between the two devices. That was different before because the Centurion, according to me, was better. Now I have no more differences. So the support and the efficiency of the device is important for me.
Ehud, what do you think?
I would like to echo in some ways what was said here. If you asked me 5-7 years ago what would like to see first, I would say the product. I'm interested in the technology. I would like to have the first in line as a gold standard. 7 years ago or 10 years ago, one company had transverse phaco, the other one had just longitudinal, but they have peristaltic and venturi. One has the ICE technology and the other one has dual linear foot pedal, and so each company has something which is specific to this company. So you have to choose between one or second or third. Now what happened in the last 5 years, all companies have excellent machines. And now for us it's like choosing from between BMW, Mercedes and Audi. They are all three excellent cars, but so our preference now is more to the support, the service, or the relationships with the company, and this becomes more and more important because machines are all good. I mean, the top machines, they provide all. You can have excellent results, and you can program the machine, all machines, to your needs. So I think that today's service and relationship are even more important than machine. The machines are just good.
I have a question for Claudio. Claudio, you are using, let's say, simultaneously the Centurion, which for many ways is considered a reference phaco instrument, and the BVI.
Yeah.
When I know the software made a huge difference as regards your feeling, but is there any way for you to prioritize one of the two instruments over the other, or do you feel them perfectly?
No. There is a problem with the Centurion that doesn't have the double foot switch. Normally I use the vacuum on the right side and the phaco pushing down the foot pedal. This is not available on the Centurion, so I have to every time change my mind, and but at the end is more or less the same. But the difference, according to me, is at the end of the phaco. One remain only a few small pieces. I don't know if the centurion that I am using is not well set, but according to me, the posterior capsule sometimes is not so stable as it is with using the RevoSmart. And this is an important difference according to me. But anyway, I know it, and so at the end,
Right.
I make some.
I'm asking you this question because for the live surgery we ran for this meeting, I had the chance to test the different platforms, phaco platforms, and what Ehud is saying,
well,
is saying is right.
I work in the public hospital
Uh-huh.
and in a private setting. In the public hospital, there is one machine,
Right,
so you have a choice of one option.
right,
And in my private, we have 6 different machines of 6 companies, and I use them all.
yeah,
And this is the nice thing, that you can go from one to the other. This is what I was saying. If you are having the right setup, and we work with a representative of the company, you can build up a program which will fit them all. So there is no much of a difference.
right.
And I think this flexibility is very important.
So let's go deeper in this topic and try to categorize the features of an instrument, anterior or posterior, whatever, into product. So all related to the stability, the efficiency of the pump, venturi versus peristaltic, and that's product. We put the second chapter as a service, which means the speed as they come to your practice for fixing a problem, but also the, let's say, the program, the customization for financial programs, all of that. And third, the relationship. How much is the company supporting you regardless to the product specifically? What would you prioritize first?
I prioritize absolutely the quality of the instrument. It has to be easy to use. It has to have a graphical user interface, easy to understand. The nurse has to be able to switch between the different options, and that is the most important part to me. There is no problem about money, because I am only in private practice, and we use the pay per hour. So every procedure is paid by the patient, so I don't care about it.
As regards to the product,
but I want to have a perfect device.
Okay, just make a very short list of the 3 best features that you prioritize for a product as regards a phaco.
Yeah.
Is it the pump? Is it the IOP? What is most important for you?
Efficiency of the handpiece
Okay.
is the most important. After that, the IOP control and the foot pedal, because they made for me the software for the double linear control. I say for me because I've seen that in the world all the people use on the opposite situation. I use the vacuum on the right side and the phaco pushing down. All the other people use the opposite. They use the phaco on the right side and the vacuum pushing down.
And this
so
goes very well.
I'm supported from them very well.
This fits very well also in the service
Yes, absolutely.
category as well as in the relationships.
Yeah.
So what
Yeah.
Claudio is telling us, I had a specific need and the company was able to react
make
and
it
fix
for
my,
me.
my,
Yes.
my problem.
Yes. Yes.
Ehud, what are the priorities
Well,
for your product?
Well, regarding the product, I think that intraocular pressure is definitely a major issue. And my personal technique is different than any other surgeon here, because I think that the pressure within the eye should be stabilized throughout the operation. No machine does it today. We have some excellent machine in terms of stabilizing the pressure as long as the irrigation line is inside the eye, like the phaco probe. Then it maintains the pressure, the feedback mechanism, the sensors in the tips or sensor in the cassette, and maintains the pressure. But when you pull out the phaco probe, pressure drops down to 0. And then you go in with an INA, then pressure builds up. You take it out, pressure goes to 0. You need to fill the eye with a viscoelastic material to do manipulation or put the lens in, then you need to wash it out, and so on. So this is, I think this doesn't work well for me. I would like to see a pressure which is stabilized, straight lines throughout the operation, from the very beginning to the end. So I personally, what I'm doing, I'm just adding an anterior chamber maintainer. It's a one more incision. You just plug it in, and the pressure is flat. And you don't need irrigation. You do INA or implantation and so on. I wish we would see it in a machine, not yet available yet, hopefully in the future. One way, simple way to do it is just to plug off the irrigation line from the FECO handpiece, connect it to the maintainer and just have it on a continuous. Then you have a flat chamber throughout the operation, but we do not have yet. As for the other parameters, well, as I said, there are different parameters for different machines, but they all work well. You may need a program for a soft lens or a harder lens. I usually use one type of programming which is good for 90% of my cases, so we don't need to reprogram. As for the interface, we need to remember that the only one who does not see the interface, it doesn't see the screen, is the surgeon. Everybody else does see it, so you don't see what you are doing. You can hear it, you can sense it, but you do not see it graphically. So maybe we need a way in which also the surgeon may be able to see what he's doing and what is the actual pressure in the eye and how the pressure or the energy fluctuates. But this is not yet available. Service is of utmost importance.
It may be developed. I mean, with the heads-up opportunity.
Correct. With the overlays.
Yeah.
Well, you can add an overlay also in the microscope. So it doesn't need to be an up, but this is something which is sometimes is missing. Right. You need to feel it rather than to see it. And service, of course, this is of utmost important. We cannot tolerate that you have a machine that doesn't function and you are stuck. So you must have a very rapid response for the company. If you have 2 or 3 machines, not a problem. But if you have one machine, that's a big problem. So our service and relationship are definitely important.
So specifically regarding service, and when we say service, we say fastness to response for a machine down, or for like a delivery of disposables. What do you feel is critical?
Well, it's
everything.
It's everything. Service is service. I mean, when you go to a restaurant, you don't say what the service. If you get the water first, or you get your dish warm enough. I mean, you want to have the whole package.
The whole package. Okay, Claudio. In this moment, due to many reasons, there are some problems that are related to supply chains, which means that sometimes when we order our disposables, they are not delivered as fast as they were in the past. How do you think the companies should react to this? In other words, do you think that the companies should stock more as to be able to provide faster what we need?
Yes, absolutely. It's important that they have a big magazine with a lot of things every day ready for delivery. Otherwise, we have to stop the surgery, or we have to call another company that can support us. But this with them has never happened. So
yeah, I think especially for disposables. So one of the pros of this company is that having so many disposable available, the company has the opportunity to offer something similar but not exactly. And this can be a good advice for your sales force. I don't have this one, but this looks very much like, until this one arrives, have a try on that one, because that's a sensitive topic. I mean, in our daily practice, we are all, protecting ourselves by, stocking products also from other companies, from competitors, which we don't like. Obviously, we like to rely on what we like the most. Yeah. And you have to think globally. I mean, we as surgeons and you as a company, how to face these issues, which is going to become more and more critical, at least from what I think. Ehud, add something.
Where the company has its stocks, I don't care. Mm-hmm. Whether they store it in our place, their place, I want to have it on the table on time. So it doesn't really matter for me. This is their job, they have the responsibility to make sure that I have available the right thing on the right time. I don't want to compromise. Another question is disposable versus reusable. So we can discuss it for an hour, but this is also an open question. And but so we would have, I would say, flexibility is probably the key point here. We should have them all, and we should have ability to choose in between and have them all available. But it must be right on time and always available.
As regards relationship, I'm just make a statement. Your FACO is working perfectly. Your stock area is full of equipment, so you don't really need anyone from the company coming and checking all of this. What do you think is important as regards relationships then? I mean, is it more like a routine visit that you like to have in your practice? Is it more like an alignment that they may want to give you as regards new devices or products? Is it more like as we are here now, speaking, support at meetings? What do you think is important, Claudio?
I normally ask them to come to visit our surgeries every month because sometimes there is something new that I would like to do, or I've seen or heard something about the new instruments, and so I want to be able to speak with them and ask them support just in case I need something else of different. And sometimes there is a problem, a small problem, they can help us solve the problem immediately. And so if they come every month is more than sufficient for me.
Well, my advice to the reps are never take us for granted. If you are not in the operating theater, your competitor will be there. And he's there, and they will introduce their products. They will come up with a new lens, with new equipment. They will show us some new miracles, and they will push their products. So don't take anything for granted. The presence of a rep is very important, just to make sure everything is okay, just to keep in line. And sometimes you have company in which you do not see the reps for 2 months or 3 months, and when they come to visit, they wonder why we change our practice. So, okay, you weren't here to support us, somebody else did. So yes, I think that the continuous support by the reps is extremely important.
So to summarize, I mean, if we consider these three pillar points: the product, service, and the relationship. Obviously, we like to have the full package. But if you would have to prioritize, what is number 1 ranking, number 2 ranking, and number 3 ranking? Product, service, or relationship? Ehud.
I would say these days, since I think that the products are good, and this is my basic concept, that the product is good, I would say that the service comes first, product second, relationships are important, but this is nice to have. This is not, your work is not dependent on that. So I would say the service should come first.
So service and the product and relationship tie, let's say.
Service, as long as the product is top quality.
Is top quality.
Yes, the same level. Service and product. The relationship is good, but can stay at the second or third place.
All right. If you have any questions, just raise your hand, so we know, because obviously we cannot hear you, but we would be very happy to address any questions. The two of us are key opinion leaders. So don't put yourself in the shoes that you have today. Put yourself in the shoes of the average FACO doctor, meaning that you are in the shoes of the one that is not really, changing parameters for every surgery because believes that this cataract is or does not turn on all the safety features. You see what I mean, right? So in this case, what do you think a company should do for raising your awareness about the product, in terms of the product can do much better, but you're not using our full options? Claudio.
And this is the reason for I want that they come to the surgery room frequently, because if there is something of new, they can show me what to do, and I never say no. I test every new idea that they have, and because never I can say no. What I do is perfect. There is every day something new, and I like that they show me what they have done of new.
Okay, now as I said, I work in two separate settings, and the private and the public. So it's different. In the public, you have all levels, starting for the first year resident to the top surgeon in the area. So it's very versatile. So you need them all. And also the company does not teach the residents. It is a job of the senior physicians. So you need to train the good doctors and show them all the available options. Now in the private section, we have multiple surgeons working in our facility. We have like 65 doctors operating, and it's not our job to train them. Then it is a company approach each one of them. And as I said, we have multiple machines, and the reason is because we do not dictate to the surgeons what machine to use and what IOL to implant. It is their choice. So it is the company's responsibility to talk to the doctors, teach them, educate them, show them the option, and whatever they choose, we will do it for them. So it's different on the system. That's what I'm saying. The flexibility is so important, and the presence, a continuous presence, is of utmost important.
All right. So please keep your shoes still in that same fit in the same shoes that we were talking about. You are an average phaco doctor. Regarding product, regarding service, and regarding relationship, if you would not be, feeling that you have to change something, you're just doing your routine job, you're happy with the parameters, they're always the same and blah, 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 where do you think product, service, and relationships would fit in this case? I mean, would your ranking put in the service first still there, or would you put more attention on the product or more attention on the relationship? Would your evaluation for the needs from the company as regards your practice be different?
In that case, the service is absolutely necessary to have. They have to be present with us when you do we make the surgery, because if I am I'm facing a case that is different, that is difficult. If they can support us, is absolutely.
So service
better.
would still be the number one.
In that
and
case,
for you,
and after that, the
Ehud,
product
would still be service number
Well,
one.
not necessarily. The product need to be adjusted, and for us, we have adjusted the machine so that all doctors can use, some kind of a baseline program.
Okay.
So we call it all doctors. Whatever you are, you can use this program, because this is probably the best compromise. And from that on, each of the doctors can choose and make his own programming.
All right.
So it depends on what it is. So the product is a major part for the novice.
The average.
For the average or the novice, the new ones.
Okay.
You make the decision for him.
Right.
And the more experienced you are, then you can be more versatile, but then you need the service even more.
Again, don't consider yourself, the both of you, like leaders, but average doctors, okay? What do you think is the most challenging, or more, are the most challenging points for a surgeon who wants to transition from one phaco who has been using for years to a new one? So where do you think are the more difficult points, like the changing in the phaco efficiency, the changing in the anterior chamber stability? Where do you think someone new to a new system would be more worried about?
I would say that if you want to adjust to a new machine, either you go to your comfort zone, make it close to what you are used to, and take it from there. And then, because if you start something new, it's all new. Mm-hmm. I would say, for example, going from phacoemulsification to a duolinear, then it's a totally new concept. It's a totally new machine. Now you need to think all the time on what you are doing. So it does take time to adjust, and you need to make a new set of mind when you're using this type of machines. So I would say my advice would be start with your comfort zone as what you are used to do, and take it from there step by step. Don't do some major changes, because you may fail. And there is never a second chance for the first impression.
And for you, Claudio?
I agree with Professor Assia. You have to start with a normal case with no surprises under the angle, and the support of the rep is fundamental. They have to stay just close to me, and they have to suggest what to change if it is the case. I tried, as I told you before, I tried once to change the double linear configuration that I use normally I have been using it for 20 years, more or less. And I tried to have the phaco on the right side and the vacuum. That was terrible.
All mixed up.
A nightmare. But after that, there
Switch
is
your foot switch.
Yeah.
You'll see what it is.
And another problem important is that the nurse has to learn immediately how the device works. Otherwise, that is another problem, because if there is not the rep, how to solve any problem that arises. So, as you say, that we have to go step by step in order to increase our ability with the new device.
Very quickly, if you were not a surgeon but a manager of your practice, how difficult or how challenging do you think the transition to a new phaco system would be in terms of, let's say, footprint, training the nurses and the technicians and all of that? Is it something that would drive you to say, I'm staying with the old machine and I don't want to go to a new system because there is too much to learn, too much to change, or that's not an issue?
Sure. Okay, well, managers and administrations always like standardization. Have the same thing. It is simpler. You don't need a big stock. You don't need versatility. This is what they like. But when you manage an operating theater, you need to provide all the options to many. So I personally like to try everything. Just as Claudio say, I would like to try everything. When something new comes, I would like to test it. I'm using in my average day 6-7 different lenses on an every day. But as administrators, I mean that's a problem. They would like to have everything the same, very standardized, very simple, no big stocks. So it's always a fight in between.
Dual machines or phaco and vitrectomy separated? What do you think?
Dual machines.
Why? Explain me better.
Because I am anterior segment surgeon, so I don't perform any type of vitrectomy. But it can happen that I break the capsule, and I don't want to stop the surgery and call the vitreoretinal surgeon and give him the patient. I want to solve the problem, and so if I have I don't want to lose time. If I'm in that condition, I have to be able to solve the problem. So if I change the handpiece and continue with the vitrectomy, anterior vitrectomy, obviously, I prefer to have instead of change it completely the instrument.
But this is something that all the phaco machines do. Having the possibility for doing anterior vitrectomy. Yeah. Also, the phaco machines only provided this option. Yeah. So why do you feel that having a dual, which means an instrument specifically designed for doing posterior?
I don't want to have to.
No. Dual means the same machine that does anterior, but also vitrectomy in the full vitrectomy, also two trocars.
The full vitrectomy for me is not useful. I prefer only an instrument that is able to make the anterior vitrectomy. After that, I give the patient to the surgeon, go to his office, and don't remain here.
Well, for me, just the opposite. I prefer a single machine for a single purpose. The number of cataract surgery is like 10 times more than they do vitrectomy. There is no one size fits all. So if you want to buy a car, you need to choose if you want a sport car or you want a truck. You don't have a sport truck, so you need to choose in between. So if I want to do a phaco, I want a machine which is dedicated to phaco with IOP preserving as for the phaco, which is different what we need for vitrectomy, and so on. If you take, for example, another company, Centurion, versus a constellation, Centurion is by far better for anterior segment surgeon than the phaco of the constellation, which is basically a vitrectomy device.
So let me say this differently. Let's say that you have the same performances on your phaco as on a machine that is dual. Would you still say the same?
If it is, if we have a machine, we don't have a machine.
Let's say we have. Let's assume we have.
And it's a different cassette, and it's a different setting, and it's a different costs, and everything is different. If we have a patient with, we can have kind of a modulary way that we can choose in between, and for a basic machine we can change the models, then it's okay. But if you need to have a startup or setup for a machine which does them both, usually it's not for the better. Two functions are not as good as one single function. For one single surgery, and cataract surgery is by far much more common than any other surgery. So I would have in my setting both. Usually use the one machine for one purpose, and occasionally the other machine in which I may need to do phaco during the vitrectomy, and not the other way around.
Right. Would your administrator say the same?
I'm sorry?
Would your administrator make the same choice?
No, yeah, of course. Again, he wants standardized. He wants one machine for all. Don't bother me with 5 different machines. Okay, we are not run by the administrators. Luckily.
All right, so let's move on the platform or the entire portfolio. I mean, one of the advantages of BVI is that it's a company providing almost everything that we need in ophthalmology. How critical, how important is having a relationship with a company that supplies everything you need for your surgery? Claudio.
I think that the company is able to give everything. So it's absolutely important to have a company. I repeat, in Rome I have them. I'm absolutely satisfied. When I have a problem with the Centurion, I have to call Alcon, and they arrive with the Zeiss. Terrible. Zeiss in Italy. It's absolutely terrible. Then you call them, no, please open the ticket, send the email, and tomorrow someone will answer to you, and after a week someone will come to. I have a problem with the Master 700 a few days ago. It's still there. They arrived after 7 days to solve the problem. It's not possible. Yeah, with BVI, I'm not paid from them. I solved the problems of my life.
Ehud, what's your thought?
It's good to have a one-stop shop. Then you go to one shop, you got everything that you need, starting from the machine to disposable to intraocular lenses, viscoelastics, and everything, which is a good news, and also it's good for the business. You asked me about the administrators. For them, it's the best. I mean, you can get the machine for free, just use consumables, and you can pay with time. So this is a good payment system. But then on the other end, you don't usually want to be hooked to one company. You don't want to be dependent on one company, which is not always the best thing. You want to have the versatility. This machine has the better femto machine, and this one has the better phaco machine. You don't necessarily want them both in one setting. And if something goes wrong, and some cassettes are missing, then you're stuck. So the versatility is good. And I would say it again and again. I mean, you need versatility and flexibility, but having one company that may provide all, it makes a good business and good deals, and it's a good service.
Do you think that obviously we know it, but do you think that a hypothetical company who wants to create some sort of exclusive partnership with your practice? No, let me finish my question. The question is, do you think that this company should find solutions beside what is clinical, like financing, like all of that, to be the company for your practice?
Well, they do. They do. Okay. I mean, big companies, this is what we try to do, to give you also support in financing and supporting in all other ways. Moreover, even now, companies present to you suites that you can have the whole system, from the diagnostic to your record, to the machine, to the phaco, to the microscope, to the phaco machine, and so on. So in this case, I mean, you are hooked to one company. I mean, you are done. You cannot change a company for 10 years because you've put so much money into it. So it has major advantages, but it also has major disadvantages. So I personally would not like to see just one way in which I'm hooked to one company. I need to that every of my diagnostic can be used at any time for any purpose. So if your company does not provide me with something which I can use with other diagnostic, then I would not use it.
Claudio, what do you think?
I agree with him. Even though I have a great support by BVI, I'm not the owner of my other surgery room where I work, so I have no problem about it. But all the companies, the major companies, give support to the surgery room that we use, and so I agree that you can have a unique company that help you, but if arrives a new instrument on the market, it's necessary to buy it, and you can stop. And no, since my company of reference are you, I don't buy the new instrument. I want to have the new one. So we have not to base our activity only on one company.
Okay, let's assume that you already tried this new phaco, so you are confident that the product is exactly what you need.
Yeah.
Okay, what are the other features driving your decisions to buy that one instead of that of a competitor who has the same efficiency? So what may be more relevant to drive your choice? In other words, two phacos are performing exactly the same in your hands, and you have to buy one. What are you asking as additional, more than the product, to drive your decision? Is it the footprint? Is it the easiness of use? Is it the possibility for having disposables as well as single use versus reusability? What do you think it may be interesting for a company to know about that?
You want to answer?
For me, is the efficiency of the device.
That's granted. What else?
Oh,
Training programs.
Yes, the training programs is important because, as I told you before, if we have a problem and there is no one able to solve the problem, what we do? So they have to be present, but again, they are present. So for me, that is the most important part. The nurse has to be able to solve any problem only if they are giving us a great support. Otherwise, so the support, the easy to use, the efficiency of the foot pedal and handpiece is important.
Ehud, do you see anything that you
Well,
may want
we
to
are,
suggest
well,
to BVI?
we are back to base one. I mean, this is what we started with. All machines are good, so now how do you choose one machine? A good deal is important. You talked about administration. Yes, a good deal is important, providing lenses, providing different types of things, and give it on time and in a good for a good amount of money. So these are all important factors that may affect. Of course, again, we must have a good product to begin with. If it is the same, then you need to look at the comprehensive deal and not just in terms of technology.
One last question. Do you think, do you see any reasons for a company to offer a premier line product for your difficult case and a much less expensive second line for the easy cases? Just to make you an example, do you see any reasons for BVI to develop the most efficient phaco tip with the most stable anterior chamber maintainer, but at some cost, and a least efficient aspiration system to do like a refractive lens exchange, but at much lower cost?
Well, that's a big problem because you know how you start a case, you don't know how you end up with.
No,
You can
sure.
start a case which looks very easy, and then you know there's phacodonesis and everything, and then you move from a very simple case to a very complicated one. You can start with a regular, easy case, penetrate the posterior capsule when most of the lens is still not the nucleus is still inside the eye, and then you are stuck with a machine which does not have very good fluidics, for example. So there can be some flexibility. I mean, you can have it because usually surgeons they do not use 5% of the capability of the machine. So you can make a much simpler device in which you have kind of a standard setup. So that's possible. Yes, you can make 2 levels, but at least for those who are dealing with tough cases, I would like to have the capability in every single case because I'm no idea when I'm going to be in trouble.
Claudio?
It's not a problem of mine, the fact of buying 2 different instruments. But anyway, if I was the owner, I would buy just one type.
No, but let's say more about disposables.
Yeah.
Let's say that a hard cataract surgery procedure costs you 100 euros in disposables.
There's no difference. I
All
prefer
right.
to use the top machine every
No,
time.
but the machine is the same. A soft nucleus like a refractive lens removal, no cataract, would cost you 10 euros. 100 versus 10.
Yes,
Would you see any reason for using the 10 euro deal, or would you always use the 100 euros deal?
I would use the tender.
No.
Okay.
Yes, I no, really. I mean, if it's a simple case and I can do it, and if it is a routine and you know case by case, okay, something goes wrong,
You can still change.
you can move to the other, just as we do. I mean, if you need to go from anterior vitrectomy to posterior vitrectomy, then you may change the machine. Okay, so you change the machine. Takes 5 minutes, and this is it. So if there is a machine which will be, as you said, as good as, without, you know, just one program or so very simple, and you can get the same results, why not?
Claudio, you would stay always on the same.
Yeah, so there's not a problem to pay the surgeries. The problem of the patient. If you want to be operated by me, that device. If you like, otherwise you can go everywhere. But I don't want to face a problem during the surgery. No, stop, please give me the other one. Let's change everything. No, it can happen, unfortunately, sometimes that something goes wrong and you should have to change everything. No, I prefer not to have this problem.
All right, so I'm over with the questions. Any questions from your side?
I'm not sure if my question is really related to this topic, but if you need to open a new practice today in the uncertain economic times from scratch, would you think about building a new practice patient-centric, surgeon-centric, or technology-centric? I'm not sure if my question is enough clear.
The question is clear. I mean, the answer is not clear.
If I can answer to your question, it depends on your target. I mean, it depends on where you're going to work, what is your population, where your services are going to be delivered. Because if you are in a heavy, busy governmental or national hospital, where you have to do case by case by case by case, you may want to build it patient, like efficiency oriented and maybe also surgeon oriented. If you're opening your boutique practice where the question is more, I have to get my patients, you may want to open it as patients oriented.
Well, I did open some ambulatory surgical center from scratches. The question is, who is your client? Is it the patient? Is it the doctor? Or it is the insurance company? Okay. Usually your client is a doctor. He brings the patients. He has his clinic. He has the patient. He comes to your ambulatory surgical center. He wants to service the best service, comfortable for himself, and then he takes his patients back to his clinic. This is the way, at least our center is working. So you need to be oriented to provide the best service for the doctor. All the rest is on top of that. I mean, it looks nice and to be easy to use, you're comfortable and so on. But out of these three components, I would say that the doctor is the leading thought when you build up a new practice.
Okay.
Any other questions? So thank you, Ehud and Claudio, for sharing this
Thank you.
morning.
Pleasure.
you.
Thank you.
Thank you.